Good morning. I'm here with Lindsay Mitchell, and she's a good friend of mine. We've known each other for a couple of years now, and I wanted to just give Lindsay an opportunity to tell our viewers a little bit about her personal experience as it comes to the concept of stress and the interplay of stress with chronic illness. So Lindsay, why don't you tell us a little bit about how you got interested in this whole topic?
Yeah, awesome. Well, thank you so much for having me. I appreciate being here. So I initially got interested in this topic because I was very sick with a chronic illness. So, being diagnosed with chronic Lyme disease and parasites and some other co-infections was pretty detrimental to hear. And I tried all of the treatments, as a lot of people do. So, trying all of the different supplements and different detox remedies, IV treatments and things like that. And some of that worked to an extent, and I would feel a little bit better. But there was a place in my kind of course of treatment that I plateaued, and I just wasn't getting any better. So I knew there was something else, and I did a lot of research, as one does when they have a chronic illness, and learned about the chronic stress response and how the brain changes when we are dealing with a chronic illness or a chronic trauma or whatever that is. And so having been a physician assistant, I knew a little bit about that, and I knew, what the stress response was. But the fact that it remained turned on all the time when dealing with a chronic illness was news to me. So I read about it and I was like, 100% yes, my brain is dealing with the chronic stress response. And when I'm in that response, stress hormones are released, things like adrenaline and cortisol. And you have this whole physiological response. So your heart beats faster, you start to breathe faster. Vital function is being taken away from things like the gut and your ability to detox. And so that made sense because I was experiencing food sensitivities and chronic pain, chronic fatigue, things like that. And so I read about this and I said, yes, yes, yes. And so I kind of went through some programs myself. I did every neuroplastic program that's offered out there just because I knew that this was an issue, it was in my brain. And so once I started to pay attention to my brain, I started to see changes in my physical symptoms. And so that was huge. And I think that's a key component that's missing a lot of times is putting focus on the brain and watching the body respond because of these changes you're making to the brain. And so once I started to calm the stress response through specific brain training techniques, I actually saw huge changes in my symptoms. And as well, since at the time you had been treating me for Lyme disease and you could kind of see that shift.
Yes, and I have to say it was surprisingly quick in your case, how once you got started in a really intentional way, you began to really just improve and move from that plateau where you were. I think with all the things we were doing to work on your toxins and your infections, we were making headway, but there was still a dramatic difference between where you were with symptoms and where you wanted to be ultimately for wellness.
Yeah, and I think a lot of times that's the missing component because you can go to different practitioners and they can say, oh, you're just going to have to live with this. You're going to have to survive and make yourself comfortable. But when I met with you, we kind of had this knowing that, okay, this sick person that I've been is not me. I see something different for myself and you saw something different for myself. And so being able to say, okay, what are the different avenues we can take to get to that place? Because I still had hope that, healing was possible. And that's really important.
Yeah, that's so important. And, one of the things that you pointed out to me in my experience with you, as well as many other people, is that when people encounter environmental toxins of a whole variety, you mentioned Lyme and parasites, but we see mold toxins, we see pesticide chemicals, we see toxic metals like mercury and aluminum, we see electromagnetic frequency toxins, and also we see people with toxic life events or experiences. Might be toxic relationships, it might be toxic financial situations, any number. That along with a person's individual sensitivity to these toxins tends to trigger them into these kinds of stress responses of the brain that then is associated with so many of these symptoms in the body.
Mm-hmm.
And one of the things I've found, and I would like you to comment on, is that so often if you look back into the patient's or the person's early life, their patterns from the past, you sometimes see things that come forward that seem to create more of a milieu or an environment where these kinds of issues are more problematic for people. Can you comment about that?
Sure. And that looks a little bit different for everyone. So, in VitalSide, where I work now, working with people who have chronic illnesses, sometimes they'll say, I've never had a traumatic experience happen to me as a kid, but I'm still sick and I still deal with chronic symptoms. And so there's big T and little t trauma. So big T trauma, the big events like abuse and things like that. But little t trauma are situations that do affect the person in a traumatic way and actually make changes to the brain. So that can be something as small as, or small because it depends on the person, but your mother yelling at you for something you did as a kid and not meaning any harm or any intentional harm, but that stuck with you and that made a change to one of those old neural pathways in the brain, and that kind of stuck with you. And especially as children, our brains are extremely neuroplastic, so we're picking up on all this information and we're kind of immediately kind of creating that into a subconscious memory. And so it's sticking with us. So many of us deal with big T or little t traumas at a young age that can make these changes to the brain. And I know personally, I dealt with a traumatic situation as a kid, and that put me into this stress response, that chronic fight, flight, freeze as a kid. And that was kind of my go-to response. So as I grew up and in my teens, my immune system was affected. So I wasn't, well all the time, because when the brain is used to experiencing the chronic stress response, the blood-brain barrier, which is, these blood vessels responsible for weeding out toxins, becomes more permeable. And so that's why people don't just come in with, Lyme disease. They come in with Lyme and viruses and mold toxicities and heavy metal toxicities, like you were saying. And so it makes sense, because whether it's that big T, little t trauma or a physical trauma, like a virus or a bacteria, that all affects the brain. And so we can get used to operating in that stress response, which has a change on our symptoms, how we feel, our mood, a whole slew of things as we, go into adulthood.
I think it's a great explanation that you give, but one of the things I want to personally underscore for people is that we're not talking here in this response of the brain about anything that's psychological. This is a true neurophysiological response of the brain. And the toxins and toxic life experiences definitely play a triggering role that should be looked at and dealt with. But why don't you talk for a little bit now? You mentioned earlier VitalSide and the program that you've now established to try to help people use this technique of neuroplasticity to establish new patterns of brain activity that don't anymore result in these kinds of chronic symptoms of illness.
Yeah, yeah. And I do think that's an important distinction to make too. You know, what we're doing is all based on scientific evidence. It's all based on, you know, studies done using functional MRIs and how the brain is actually changing. So it's kind of this new area of medicine that we're tapping into here, which is really cool. So in Vital Side, I use neuroplasticity. And so this is kind of a fancy word of saying the brain's ability to change. And this is something that we've known for decades now, and we've just been able to prove within the last decades, but something that's been going on, you know, forever. And so the brain's ability to change, to adapt, to create new neurons, neural pathways, things like that. And so when we get stuck in that chronic stress response, whether it's from a physical trauma like a bacteria or toxin, or a mental or an emotional trauma, which is kind of what we talked about earlier, could be a specific situation that happened. And then when we have long-term exposure to that trauma, we can get stuck in the chronic stress response. And so that's usually people who I see. So I work with people in Vital Side to calm that stress response. And it's usually the person who has been sick for months, usually years. And they come to me and they say, I have been doing this, 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 and this. And it's about 100 different treatments. And, you know, nothing is making me feel better. I still feel the same, and maybe I'll get a little bit better, but then all of a sudden I'll plummet and I'll feel really bad. Or I'll have a Herxheimer reaction or, you know, die off symptoms, and then I'll just stay there and I won't feel any better. And so a lot of times this is the type of person that, you know, is ready to join a program like Vital Side because you know, what I do is non-pharmaceutical, non-medical. We work together to calm the stress response using specific brain training techniques. And part of it is what you said is identifying those old neural pathways, those old patterns we're used to using when dealing with a chronic illness. And we're breaking those old patterns and creating new ones so that we actually can create our destiny and we can actually change our genetic expression through this concept of epigenetics, right? So we're doing a combination of that. And so first it looks like identifying those old neural pathways, creating new ones and making changes to the brain that actually changes the neurochemicals you experience in association to a symptom. So in association to pain, fatigue, anxiety, whatever it is. And so something that's so empowering is that we have the ability to change what neurochemicals we experience. Just like when you laugh and you feel it in your belly and you stimulate that vagus nerve, you know, you are actually releasing dopamine in that moment. And so we actually have the ability to change those neurotransmitters, those neurochemicals in our brain. And that ultimately what makes changes to the rest of the body and changes to our symptoms. So that's what I focus on in Vital Side.
Great. I know it's probably generating a lot of questions on the part of our viewers of exactly what does it look like. Well, why don't you just tell us, like, how quick does it work? And at what age can you actually start learning how to use this concept?
Sure. So everybody is different, and it takes consistency and practice to make these long-term changes to the brain. And that's something I always try to, highlight at the very beginning when I talk with a client. And so sometimes people see changes within just a couple of weeks, and all of a sudden they start to see calmer doing these exercises every single day. And along with doing these exercises about 30 minutes to an hour a day, it is a lifestyle change. So there are things that you have to change in your home, the language that you use to yourself, to other people. So it is quite a change. But if you are committed, and if you are like me, who is like, I will do anything to heal, then this is for you. So you can see changes within a couple of weeks, but it really takes about 6 months. And 6 months is the time that you can kind of create those new neural networks. So every day we can change what neural pathways we use. So we can use the same neural pathways. So say, for example, you come home from work every day and you automatically turn on the TV, right? And so that's a strong neural pathway that has been created through habit and through conscious thought. And now maybe it's sort of like you're on autopilot, coming home and doing it every day. So if you decide to come home and all of a sudden you decide to go for a walk, you've created this new neural pathway in the brain. And when you do that, and you consistently go for that walk every day, you're pruning away that old neural pathway of sitting down and watching TV. So it kind of decreases that habit. So eventually you can get to the place where maybe the walk is on autopilot. And that's how fast our brain changes. Is just, within a day, within milliseconds, it can change. But it takes time to create those long-term changes, those changes to your neural networks. And we say about 6 months because that's how long it takes someone who has dealt with a stroke or a traumatic brain injury to really heal that part of their brain and make changes so that they can be well and be healed. So it's about 6 months, but for some people it's less and some people it's more. But it really requires that consistency every day in those lifestyle changes.
So Lindsay, that's great. I know you're here in Austin, but I suspect that a lot of the folks that might want to interact with you might not be local. So why don't you tell our viewers about how that could work for them practically if they wanted to try to access you?
Sure. Yeah, and the great thing about it is my practice quickly escalated to an online program just because that's where the need was. I was getting people reaching out to me from the UK, people from Brazil, because this is such a novel concept. And being empowered that you can actually make changes to the brain that makes changes to the body is an incredible thing to know. So what I do is I offer free consults to anyone, and these are online just through the platform of Zoom, just like how we're talking now. And we schedule them in Central Standard Time, and then we meet through Zoom. But in addition to that, I have video programs. So if, we meet for 25 minutes and you say, this is 100% for me, you can complete a video program. And so that video program is available. You go on my website, you click on the program you want, and there's 2 offered right now. And you can start it immediately. And you're given the guidebook so that you can fill out the worksheets along with the content. And it's designed as a 5-day course. So that's kind of what I've gravitated to just because I've seen the need, nationally and internationally. And so that's an awesome option. And I do also offer live vital side programs, which is just, one-on-one through the platform of Zoom, and we go over all the content together. So you'll learn all the techniques one-on-one in this individual setting, and that's live. So there's a couple different options. But no matter what you choose, you get at least one individual session with me. So that's meeting one-to-one, because I see how important it is to create a plan designed based on your symptoms, because everyone's a little bit different. Everyone learns differently. Like you said, everyone presents with, different issues and different genetics and things like that. So when we meet in that one-to-one setting, you'll get your own plan. And then I also have this Vital Side education program, which is amazing. No matter what program you sign up for, we meet once a week through the platform of Zoom in a group setting, and we go over one topic that has to do with neuroplasticity in more detail. So that's for 3 months, and I love that because we get to interact and different people get to talk with each other all over the world. So that's a pretty cool addition to these video programs as well.
That's neat. And that does kind of seg into a question that I thought some of our viewers might have. And if they go through your program and really, really try hard and do everything like that you recommend, is this the sort of thing that they'll finish and then they'll be well and done, and these new patterns will be established and that will be the end? Or what do you see as ongoing in these kinds of situations? And can people have flares? Can they encounter triggers that may in the future lead to flares that have to be dealt with?
Sure. So the goal of the program is to heal from the chronic stress response. And that's, 100% attainable. And once you do that, you see changes to your symptoms and the stress response, and your immune system starts to heal and work for itself again. So actually making a full recovery is possible. I did it, I know people who do it all the time. So that is incredible. However, the thing about the brain and this concept, this neuroplasticity, is that it's changing all the time. So when we decide to do a scary movie marathon for 48 hours and we are, paying attention and focused on that, that can trigger the adrenaline response, right? That stress response. And so, if doing that is important to you, you can do that. But now you have these techniques that you can use to get your brain so it's not stuck in the stress response. Because the stress response is ultimately good, right? It's this primal innate response takes place in the limbic system, which has helped us run away from our predators for, all of our existence. And because it puts us in that fight, flight, freeze, run away, get the heck out of Dodge or stay and fight. And so it's a good thing, but we want to prevent getting stuck in that stress response. So if you do that 48-hour scary movie marathon, it's important to then do the things that also make you feel good after that, so you don't stay in that stress response. And so adding these techniques to your daily life after having healed is important. So keeping up with brain optimization, eating healthy fats that make you feel good, that help the brain operate, exercising, doing these things that help the brain to function optimally. And then through this process as well, there are times where all of a sudden you may see an increase in symptoms. And so that may be because of a few things. So first of all, check on if you're doing these techniques every single day, or if maybe you stopped for a few days, and then if that's the case, get back to it. But also what starts to happen, which is really interesting. So this happens with a few of my clients, and they'll be doing the practice for about 3 months. They'll be feeling really good. They'll be, kind of getting stronger. Their immune system's starting to work again, and they get sick, right? So they get a cold or the flu.
Or maybe they eat some food with food poisoning, or they go into a moldy building or something else that acts as a trigger.
Sure, yeah. So life happens all around us, right? We can't always avoid everything, and we don't want to avoid because we want to live in life. And so part of that is that the immune system is working, right? When we get sick and we get fevers and we're fighting, right? We're fighting this virus. And that can be a good thing. And that's a very human thing. And what, I'll usually get that email on day one. And I'll say, okay, this is your body telling you to rest, that it needs to fight this off. It needs to work for you. It's time to rest and relax. And what I'll notice and what they'll notice is that sickness, it won't stay as long as it used to. So whereas before it maybe put them out for 2 weeks, 3 weeks, now they'll get better in 1 week. And they're like, oh yeah, you were right. Like, I'm back to it. Now I'm practicing every day. So it's this patience with yourself, patience with the brain, because everybody is learning all the time, making changes to the brain. And so understanding that it takes time and it's okay to experience, that kind of illness or whatever it is, because that's temporary and that's just us living our lives. So it's kind of an interesting thing when that happens. And also sometimes people who deal with chronic pain, all of a sudden they become more active because we are incrementally progressing to get them to the point where they are going for that walk around the block. And they'll come home and they'll be like, wait, all of a sudden, my muscles hurt and my legs and my thighs hurt. And I'm like, okay, have you been training with that? Oh yeah, I'm starting to move my body again. And so we're creating those changes even to your muscles, creating that muscle memory. So it's not necessarily a bad thing. So that's kind of something to keep in mind throughout this process too, is we're making these changes to the brain, changes to the body that do affect you. And so sometimes you'll feel a little bit different, but it's not necessarily bad. It's good progression a lot of times.
Well, these are certainly things that we see all the time in our practice, that people can have little setbacks, but they don't typically last as long because now their immune system is so much stronger and their detox pathways are so much more functional. But one of the things is in today's world, because of all of the increased toxins, whether it's air, food, water, the electromagnetic, and our more stressful lifestyle, driving on the expressways, watching those movie marathons, playing those video games, we're in a more stressful world than we were, 100,000 years ago. But I think this has been really, really hopeful and helpful for folks. I'd like you to finish up by just making sure that people know exactly how they can access your programs and what you can offer people. And after that, I just want to say how much I appreciate you jumping on the Zoom with me today to be able to get this information out for folks.
Yeah. Thank you so much for having me. And, it's people like you who are making changes to lives, because there are chronic illness, people dealing with chronic illness, chronic symptoms everywhere. So being able to come to a practitioner who can kind of treat you in a way that treats all different aspects of the illness is so important. So I just want to say thank you personally, and thank you also, from a lot of my clients who work with you.
Thanks, Lindsay.
Yeah. So, if you want to schedule a consult with me, you can just go to www.vital-side.com. And there's just a place where you can schedule that free consult. You can also check out my video programs there. You can also follow me on Instagram, and it's My Vital Side, or Facebook, and I have a Vital Side group there as well. And that's kind of cool because I post videos like this and kind of tidbits on how to make positive changes to the brain, because a lot of people just need the resources. And, even if you're not dealing with a chronic illness and you want to make those positive changes to the brain, like you said, we're dealing and living in a stressful world. So not only are we surrounded by more toxins, but we are also dealing with high stress jobs and pressure from loved ones and all of these different things going on. And so it's truly important to kind of just ask, how can I make beneficial changes to the brain? If that's you, feel free to check out my content as well.
Did you mention Facebook and Instagram?
I did, yes.
Good. Okay, perfect.
Yeah.
Well, thanks again, Lindsay, and I salute you for everything you're doing. I know you've made a big difference in many of the lives of the folks that I see, and I know that you have for others around the world. So just keep up that good work. It's great to see you looking so vibrant and full of life. I remember a day not so long ago when it wasn't quite that way for you. So So I'm just really thankful for what, you've been able to learn to accomplish and are now sharing with others. So God bless you.
Thank you. Thank you. Thank you so much. And if anything, I like to just tell people that it is possible, right? It is possible to heal. And that's why I'm here, is to tell people that. So thank you.
Absolutely. Take care.
All right. Bye-bye.